When it comes to a bursitis or a tendonitis, we really want to figure out what is causing that. Why is it so important that when we have hip pain, the other things that we want to be looking at are our back as well as our pelvis. So if we think about the hip joint, it is a ball and socket joint. It is the long bone in your upper thigh area, and it's touching the socket part, which is part of the pelvis. If that area is tight for any reason, so we can have muscles that are really tight, any imbalances that are kind of happening, maybe we have an alignment issue that's currently happening within that area. It can actually really impact not only the hip itself, but it can also really impact the lower back. Our hip is actually supposed to be a mobile joint. It's supposed to help us walk. It's supposed to help us move. If it's really tight and it's not moving very efficiently, then that's going to offset the mobility that is required in our hip to our low back. So that's the reason why sometimes our back could be really painful. It's supposed to be more of a stable joint. If it is making up for the lack of mobility in the hip, we could be experiencing some low back pain.